Hi guys, it's Dr. Taylor with Taylor Made Integrative Therapy. This is our third video in our joint by joint series. The first two videos were the stabilizing the foot and mobilizing the ankle. I am actually going to skip the knees and go right to the hips. I found that working on the hips and getting all those muscles fluid and working, as well as the ankles, tends to fix the knees. But we will be doing a knee series after that, okay? So first I wanted to do some tests, okay? There's kind of three tests that I like to look at, which will help narrow down which muscles you need to work on. I'm going to show you all the muscles, but during the videos I will go in specifically and tell you, hey, if you failed this test, work specifically on these guys, okay? All right, so the first one is called the Thomas test. It's where you lay down on a table or a counter, something firm. Don't do your bed or a couch because the softness is going to kind of give you a false positive answer. But you'll lay down on your back, you'll bring your hip up towards your knee, and let your leg fall off the edge of the table. A good Thomas test would be the thigh resting parallel or below the table, the knee bent at 90 degrees and in line with the hip. If your knee or thigh is above parallel, that usually is indicative of tight hip flexors like the psoas. If the knee does not bend 90 degrees, that's usually indicative of the tight rectus femoris muscle. The fifth test is the favorite test. You will lay on your back. Make sure you keep your back flat on the table and put your left or right foot on the opposite knee and let the knee fall out to the side. Make sure that your back remains neutral and parallel to the table. Don't let it roll to the side. If you can put two hands under your knee, then that's considered a passing test. If not, then you definitely have some hip restriction issues. That could be the capsule, that could be the muscles like the groin, the IT band, or the external rotators. And the last test is the hip flexion test. So you'll lay on your back, bring your knee up towards your chest, and if you can get your thigh resting on your rib cage without any pain and without your butt or your sacrum coming off the ground, then that's a passing test. If you do have some pain, that could be any number of things, but hopefully clearing out the muscles and the hip capsule will clear that up. If not, I would recommend talking to a medical professional. One of the biggest hip flexor muscles that we need to worry about is the psoas. It actually attaches your lumbar spine and your pelvis into your hip. So there are a couple of ways to work on the psoas. You got this mean, vicious guy right here. I don't know. This is just seems like medieval torture. Not a big fan. I know a lot of people will use kind of a hard ball, like a softball, something like that. But I actually prefer something a little softer, okay? I actually started out with like a Dodge handball, something with a little grip on it. But this guy is just a little weighted medicine ball. It's just the perfect size. This is going to go right between your ribs and your pelvis, all right? And we want it to get in there deep. So you don't want it too big, you don't want it too small. But you're going to lay down on here, okay? I'm going to show you from this side. You're going to kind of come in at a 45-degree angle and straighten everything out. So I'm doing my right side, so my right arm's out, my right leg is out. All right, if this is super sharp, then just stay here and breathe a little bit. But once that sharpness goes away, you're going to try to twist around the ball. All right, right now it's winding up my fascia, my tissue, making everything really tight in there. And then I'm going to go up and do kind of a cobra pose, keeping my abdomen on the ball and doing some nice breaths. I like to stay there for about 3 breaths, just let my body adapt. And then come down, and if you can wind it up again. All right, I like to do about 3 wind-ups and then move on to the other side. Okay, so let's start with the rest of it. So we did the psoas, the rest of the Thomas test. If your knee does not bend 90 degrees, we want to work the rectus femoris, okay? That muscle comes right down the middle. I'm also going to show you how to get the vastus medialis and vastus lateralis. So for the quadriceps, I like to do one leg at a time. Use your other leg to either put more pressure on the foam roller by lifting it off the ground or using it to support you if it's real tender through here. All right, now usually right in the belly of the muscle is where you're going to find the biggest knot. There it is right there. So I'm going to stay there and breathe. We can contract and relax. So flex that quad muscle and relax. I can cross friction a little bit side to side, or I can tack and floss my knee. And make sure you go slow, move up and down. Make sure there's no other knots after you work on that guy. For the vastus medialis, we're going to turn a little bit, and we're going to work the inside, and there's that guy, okay? Attack and floss again. And then for the vastus lateralis, I'll just roll to the outside, about a 45-degree angle. Now for this guy, you can see I'm going up high. This is that tensor fascial lata muscle I was talking about. So when you do the Thomas test and your leg, if your knee falls out to the side, you definitely want to roll this guy out. But notice how I'm keeping everything straight, okay? I'm not rolling and not curled up like this. So get some extension in your hip and slowly work your way down. So there's a good knot right there. I'm attack and floss. Okay, now I'm doing this a lot faster than you normally would, so don't be afraid of it. Stay on it. Knock it out. All right, so now we're going to work on the groin. So if you did not do well in the Faber test, this will be a critical muscle for you to work on. We call this one the hot dog in the bun. So the foam roller is the hot dog. Your leg's going to be the bun, okay? So you're going to come up here. You're going to get that knee up as high as you can towards your head. Kind of go into a plank position. So get that back leg off the ground and try to get all your weight pressed into this top leg. What I'm doing, I'm trying to rotate my pelvis towards the ground and keeping it parallel. All right, and usually the tightest spot on this one is going to be right there by the pubic bone. So guys, be careful. And then work your way out. And again, you can tack and floss, bending and straightening the knee. You can cross friction up and down. But stay on that for about 30 seconds to a minute. Okay. Next area we're going to roll is the IT band. Okay, it's right here on the outside of the leg. Here's your hip bone. Do not roll over that. So you're going to stay between the bottom of that hip bone and then the knee. Okay, do not cross those joints. This area is paralyzingly painful for most people. So do what you can. I'll show you how to take some weight off. So put that foam roller down. You can put this leg down, take some tension off, and slowly go up and down. Notice I'm keeping my body and my leg in a straight position. This is another one where people will try to get all hunched over. So try to stay nice and long. And when you find that tender spot, try to bend and straighten your knee. That IT band gets glued down on top of your vastus lateralis and your hamstring. It's a great way to break it up. Okay, and the next muscle we need to work on is the glutes for that Faber test. With the foam roller, you're going to sit on top of it, put the ankle on top of the other knee, and we're going to roll around. Okay, get out right on the edge of that hip capsule. Work your way up, work your way down. Try to find those tender spots. If you're having trouble even getting your foot up on your knee, you can do it with the leg down. You can lean back and get into that glute a little bit. Okay, for the hamstring, I don't like foam rolling it. It's a pretty thick, deep muscle, and the foam roller just doesn't get into it. So you need to get like a baseball or a lacrosse ball. Try to find a bar stool or something up high. If you're at a CrossFit gym, do it on one of the jump boxes. But if you got a bigger hamstring, use like a baseball. If you got a little smaller hamstring, you can use a lacrosse ball. But you're going to get that ball right in the middle of your hamstring. Scour around, try to find some tender spots. And when you find a big old knot, you're going to stay right there, press down into it, and just let it sink in there for a second. Okay, give it some time to kind of sink deep into the tissue. And then what you're going to try to do, you're going to tack and floss it. Straighten your leg. Ooh, that's all I got right now. All right, bring it back down. Notice how I'm not compensating. I'm not leaning back. I'm not letting my leg come off the ball. This is like a paper clip, right? You bend a paper clip 20 times, eventually it just breaks. That's what's going to happen with your fascia here. So you just keep working it every time. You should be going a little bit farther. Ooh, get a little shake there. And then now I can straighten my knee. All right, so we just finished the self-myofascial release. I would go back and do your Thomas test, your Faber test, and the hip flexion test, and see if that cleared everything out. If you're still feeling some tightness or some pinching, it may be more inside the hip, like the joint capsule, that we need to loosen up. The best way to work on that is with the bands, okay? So just like we did with the ankle, we're going to use the band to help mobilize the joint capsule itself. Do about 30 seconds on all these. And again, this is mobilization, so you're going to balance, you're going to spring through there, you're going to move. It's not just a stretch. So if you've been sitting on your butt all day long, it's actually jammed your hip kind of forward into the hip socket. So this is going to help clear that out and pull it back in as you go into that deep groin and upper hamstring stretch. This one, the first one, is really good if you're doing squats or you're a CrossFitter. You need to get down into that deep squat. This really helps open up the hip. So you're going to put that band right inside of your groin there. You're going to get some good tension. So get your foot out in front of your knee. You're going to get a little runner's lunge stance and lift your back leg off the ground. Just kind of pulse through there. You can rotate your knee in and out. Getting a rock back, kind of get a little bit of a hamstring stretch. But what you want to do is try to get that elbow down on the ground inside that foot if you can. All right, so from there, we'll go into the pigeon stretch. This one's good for the Faber test. It'll help stretch out that posterior hip capsule and open up the external rotators. So try to get your knee at 90 degrees. That band is still right in that hip, pulling it back into the socket. And then just slowly sit back. Again, pulse down, moving in and out, rolling up and over. All right, and we'll move to the next one. So the band is on the inside of my hip. It's trying to distract it out of the socket a little bit. This will help loosen up that IT band and that outside hip capsule. All right, and then we'll just turn around. Now we'll keep the leg down, get that band right in the glute crease. You're going to tuck your pelvis, squeeze your butt, put your hand up in the air, and bend away from that hip. A nice good stretch, getting the psoas, getting the TFL, and that rectus femoris muscle. Okay, so now that we've mobilized the tissues and the joint capsule itself, we want to activate the muscles, get them strong, get them turned on. So to activate the hip flexors, you're going to put a loop band around your feet. You're going to lay back, pull your toes up, flex your knee towards your hip, hold for 5 seconds. These muscles are really tight, but they're also really weak. Okay, we sit all day long, but we're not activating those muscles. So it's important to stretch them out, but also activate them at the same time. All right, you can just alternate holding for 5 seconds. I do about 10 of these each leg and move on to the next one. Okay, to reinforce the hip flexor stretch that we've done, we want to activate the glutes. So one of the best ways to do that is with a glute bridge. So when you do a glute bridge, you just push those hips up in the air. Now the important thing is to make sure that you feel it in the glutes. If your hamstrings are cramping up or your back's hurting, then you're not doing it right. So what you can do is be intentional with your movement. I want you to try to activate your glutes. So squeeze your butt right now without flexing any other muscle. All right, don't push your hips up in the air. Don't tuck your pelvis. Just squeeze your glutes. Hold that contraction and then push back up. Okay, and then back down. And again, hold those for about 5 to 10 seconds. When you get stronger, you can put some kind of resistance, either a weight or a resistance band across your pelvis, and push that up again. Hold for 5 seconds. And then when that becomes too easy, you can grab your other leg and go into a glute bridge here. This one hits a lot of things. You're going to get a hip flexor stretch, a groin stretch, a glute activation. We'll be stabilizing the foot and also mobilizing the ankle all at the same time. So start tall kneeling, have some kind of weight in front of you, like a kettlebell. This is going to help activate your core and keep you stable. You're going to put one foot up, keeping that foot tripod stable. We're going to be mobilizing through the ankle. You're going to be driving that knee out. And you'll be going into kind of a lunge here. Nice and tall. My knee wants to drift in. I'm going to drive it out. And I'm going into my stretch. Keep driving that knee out. Focus on the glute. Feeling that stretch through here. Making sure you don't lose the arch in that foot. We're getting that whole immobilization. All right, so do about 10 of those each side. Really open things up for you. This next one's called the Comerford Hip Complex. It's going to work external and internal rotation of the hip in 3 different positions, okay? I like to grab like a little resistance band. It's going to help engage the core, and it'll help you open up the hip a little better. But essentially what we're doing a clamshell and a reverse clamshell in 3 different spots. So you're going to open up that hip as far as you can go, and then back down. Now notice I'm not rotating through my back. Keep that core active. All you're doing is rotating through the hip. So you do some clamshells and a reverse clamshells, just lifting that foot up. Then you're going to just lift the leg off the ground. Try to keep the knee in one position, rotating in and out. And then we'll go into a neutral. All right, do 10 external and 10 internal rotations in each of those positions. All right, guys, well, that's it for the hip mobility video. I hope this was helpful. If you have any questions or comments, give us a shout. Otherwise, I hope you enjoyed it and have a great day.